Hello everyone, Zoe is here with another video and another guest. As you know, I'm passionate about helping graduate students and immigrants to get familiar with work industry and job demands in Australia, or junior ones who want to get closer to their dream senior roles. Today, I'm going to interview Ahmed Vardu, who is an experienced cosmetic injector. If you want to know more, hit the subscribe button and watch the video. Hello, Ahmed. How are you? Thank you so much for joining us today. So, Ahmed, as you know, we already had a chat with you before, but then I've been asked to have another interview with you because people had, like my audiences had a few more questions. So, thank you so much for taking your time again to answer our questions.
Thank you very much. Thank you for having me.
Thank you. So to start, Ahmed, can you please introduce yourself again and tell us a little bit more about your career journey, please?
Sure. My name is Ahmed Vardu. I'm a cosmetic injector in Sydney. I'm originally from Iran. I came here as an international student when I was 18, 19. I went to uni. I studied Bachelor of Nursing first. Graduated back in 2004. Worked as a surgical emergency nurse for a couple of years, went back to uni, did pharmacy degree. I did pharmacy because of my love to pharmacology and drugs, mode of action in body. After graduating, I worked as a pharmacist for a couple of years, into medical cosmetic industry. The combined skills of a registered nurse, especially working in surgical and emergency wards, and the knowledge of pharmacology I guess made me a perfect candidate to pursue a career in cosmetic injection, when you need to know the understanding of the medical basis of cosmetic injections, and also have the skills or hand skills or needle skills or syringe skills of an cosmetic injector.
So professional.
Thank you.
Thank you. So, Ahmed, if someone is already registered nurse like you, or has studied Bachelor of Pharmacy like what you did, and
Yes.
They want to be a cosmetic injector, which course do you think it's better for them to take to just help them to be on the right journey?
Sure. Look, basically in Australia, once you're a registered nurse or a registered doctor, you don't even have to be a general practitioner. But if you're also a dentist, you're allowed to practice in the field of cosmetic injections. So by law, you're allowed to inject people with fillers and Botox. So in terms of regulation, that's as much as it is. It's not very well regulated as plastic surgery is, or so other branches of medicine or pharmacy or nursing is regulated, because it's a very fresh field. So pretty much whoever's under the umbrella of APRA, which is the Board of Health Practitioners, are allowed to inject. They are pretty much allowed to practice in the field of cosmetic injection. However, obviously, like anything in life, if you have more experience and you take extra curriculum courses, it would also help you to be successful in what you're doing. For example, if you're a registered undergrad nurse, never dealt with big complicated cases, or you haven't seen fresh blood coming out of an artery, I think that sometimes can be a little bit tricky, because first of all, you need to know how to manage this situation first before you can, calm the person down. Often I've seen in the area of cosmetic that nurses only do a degree, 3-4 years of degree in nursing, and in a hope to become a cosmetic injector. But once they're in the room and they have to deal with pain and blood, people fainting and all that, it wasn't that appealing. They didn't enjoy it because they were also in a stress.
They didn't know. Of it then.
Absolutely. So in short, you can do 3-4 year course of nursing and do this job, but I honestly, and I don't say this to, you know, scare anyone or make this like a rocket science course, but having worked at 2 or 3 years at least in hospital or you know, somewhere with a little bit requires more knowledge of anatomy of the body and how body behaves through different situations, whether it's being pain or panic situation, it would definitely help you to become a better practitioner.
Okay, so there is no, like at the end, after all those practice and experience, is there any specific course that they need to take to add it?
Yeah, absolutely. So when I started working in cosmetic industry or cosmetic injection industry, there weren't many courses. At the time, there was only Australian plastic and non-surgical cosmetic ASAPs. I think the short for ASAPs was the course. You know, most people would attend to learn the skills, how to do Botox and what is filler and how to do filler.
That's right.
I think still ASAPs is one of the most credible, most prestigious course to do, and it takes probably longer than other courses. But I know from, you know, Google search and people ask me, there are in fact courses as short as 1 or 2 weeks to do to kind of know what Botox does or how Botox works. The courses that I would recommend is ASAPs, and it's ASAPS. PAS, and also anything shorter than 12 weeks is probably, it's not long enough, because you want to see real people, real models work on the faces. You need to wait for 2 weeks to see the result of your work at least, and you need to at least repeat that in 2 or 3 sessions to be confident enough to, you know, touch anyone's face. So my advice is to people, obviously there is no shortcut to success. My advice to people is do your research before attending any courses, because sometimes these courses can be very expensive. They start from anything from 5-6 grand like per day to 20 grand. So usually if it sounds too good to be true, don't try it. It's probably most of the time it's just marketing, but do your research and try to speak to people who've done the course and they're actually in the field and see if they gained enough experience. Often people go and spend 5 grand in a hope to finish in 2 weeks' time, but once they're out, they didn't gain that much experience, so they're not too confident to, you know, practice. I think the best way to approach in this industry is to join a medical center or a plastic surgeon as an undergrad, as someone who's trying to learn, and watch the plastic surgeon. There are practices in Sydney, especially in Sydney, that a nurse would join the clinic as an assistant to the doctor or to the plastic surgeon or to the cosmetic injector to learn for, you know, and they get paid because they're working, right? And within 12 months' time, I think those are perfect people, you know, they've been through a lot of different scenarios, and that's probably the best way to enter the industry.
Okay, good to know, because I've heard that, like, from audience, there are some short course but expensive one out there, and they weren't sure, like, is that the proper one they have to take, or okay,
that's fine.
That was a very good advice.
Exactly. Again, because it's not very, very regulated, you know, in Australia, it's a big umbrella that people are practicing under. It's a very good area to market and sell your courses if you're running a school. So charging 3,000 to 5,000 people for a 3-day course, as you can imagine, you know, it's not just long enough. Yes, you can learn. I can teach a monkey what Botox is and how to inject, really. So it's not a rocket science, you know, to tell people you need to do this and that. And these are pretty easy, self-explanatory. But to put it in work and see the result in 2 weeks' time, it's completely different. I remember the very first time I did any lip injection, I think I practiced for 6 or 7 months before I do my very first lip, and still after all these, you know, experiences and seeing blood and all swelling and all, I was still nervous to inflict pain or give someone a bruise. So yeah, it is important to have practical work, not just theory, because theory is, you can learn it from book or watching videos.
And if in the future you want to have someone as an assistant or someone
Yeah.
like to be hired in your kind of like company or whatever,
Yeah.
like what do you prefer? Do you prefer them to have that practical experience, or you want them to have many qualification in their resume?
That's a very good question. It depends in what capacity they're joining my clinic or they're willing to work with me. If they're joining the clinic as an assistant to learn and, you know, helping me out with the procedures, they probably get, I prefer someone with not much experience, you know, as long as they're willing to learn and, you know, do their duties within their specific, you know, it's been explained to them. I prefer someone who hasn't had that much of an experience, to be honest, and younger, more motivated person. But if someone's joining the clinic as a full-on practitioner, you're not injecting in the clinic, obviously I would prefer someone with at least a couple of years of experience. And it's not just the skills at work, the skills of how to treat your clients, how to treat your colleagues and all that. So obviously, both scenarios, I prefer specific tasks or skills. If you're joining as a full-on injector, obviously more experience in education, the better, the more the better. But if someone's joining as a learner, or let's say call it internship course, that's obviously someone with no experience would be more ideal.
Cool. So, Hamid, getting back on your profession, so like, which age do you think is appropriate for women or men to take injections on their face, body?
Yeah, look, this is a big debate. At what age people should start, there is no number. Legally, people over 18 are allowed to decide whether they want the injection. If people are under 18, obviously there need to be a medical reason. For example, Botox for medical users, or sometimes even filler after a plastic surgery under 18, but they need to be consented with their parents present. Over 18, it really, I try to make it sound like a medical condition, really. We have headache, we go to the doctor to find out what's causing the headache, and we take a couple of Panadol. So if we have headache when we are 5 years old, 5 is too young to have that much of a headache. But if we get headaches at 18, we definitely want to go and investigate it. Mm-hmm. And obviously, if there is underlying issues, we need to eliminate that. Same as that. If someone's an 18-year-old and their skin is full of wrinkle and they have facial expressions that causing so much lines, like fixated line, obviously this is a way to treat it. But it's more of a cosmetic preference. No one needs any cosmetic injection in the world. You can be 80-year-old and never had any Botox or never had any filler, and the skin looks amazing. Obviously, there is a bit of a genetic background into it, and the lifestyle is important, and people's preference, to be honest. But in short, if someone's got really premature lines in their 20s, they start to see fainted lines, or the quality of skin has dropped dramatically as a result of weight loss, or again, lifestyle, lying under the sun, so the skin's conditions drop. Obviously, and the sooner we start the treatment or preventing it, and the better the result would be, and the more natural it's going to look like. As opposed to someone waits until they are in their 30s, late 30s, with very, very deep lines, and you can't do much about it. That's when people decide to start those things, and they start to do it too much. It just doesn't look good, nice enough, and that's what you see around us. So many people look deformed, and the face is a bit, like it's a little bit changed because they've done so much in a hope to get to that stage. And obviously, we have people taking, like anything in life, people take it too far. Sometimes people like that huge-looking lip, duck lip, but it's not supposed to be like that. So, it's a personal preference, but as a practitioner, if you ask me what age for women or men, there is no age as long as, they meet all those legal requirements. And obviously, if you trust your injector. You're going to listen to what he or she's got to offer.
Yeah.
And a good indication is to have a look through before and after photos of each practitioner, because that kind of gives you an idea of what the style of this person is, what the style of injection they have. You see a lot of before and after photos that I make, innocent looking, small lips, like a huge puffy lips. Obviously, that's an indication that I prefer that kind of a look. And there are some practitioners in Australia and around the world would go for that look. But if you see a lot of, subtle look before and afters, trying to eliminate little lines and it's closer to your liking, then that's your practitioner. You're closer in that realm.
That's right. And one more question. Recently there is a debate about effectiveness of cosmetic products or cosmetic injection.
Yes.
What is your opinion? Like, which one has more side effect? Which one is more effective in the case for kind of like in the case of beauty? So what do you think about it?
Look, and the way I usually answer this question is to explain what cosmetic products are and what are the cosmetic injections. So cosmetic products can start from range of sunscreen, which is awesome. Everyone in Australia, at least, they should apply sunscreen on daily basis, because that will prevent the skin getting damaged through UV light. That we are very high. We have it in the air, even in Australia, because of the ozone layer. So each to their own, really. Cosmetic products, as in skin rejuvenation products, moisturizing, these are all good products to prevent aging process or slow down the aging process. But cosmetic injections are for treating more serious cases, really. So once we have line around the eyes, there is no cream in the world topically that can cure lines around the eye. Yes, we can use hyaluronic acid creams around the eyes, and it kind of softens the lines temporarily, because it's just not going to last long enough. So the next day you wash it off, after a week you start to see the lines. So that doesn't do the job of what Botox does. Botox is basically relaxing that muscle, so eliminating what's causing those little static lines. By relaxing the muscle, we allow the skin a little bit of a break time to repair itself. Right? So analogy I'm making is like, imagine you're wearing a leather shoe. You walk on your leather shoe on daily basis every day. Obviously, the shoe is going to look older much quicker than if you have your leather shoes in your closet and you only wear it at every dinner party 2 or 3 times a year. So basically, Botox gives that muscle a little bit of a break, so the surface of the skin doesn't get traumatized, and it gets a bit of a chance to repair itself. So the way Botox works is, within that 2 weeks time, once the Botox kicks in, the skin starts to repair itself. And the younger the skin is, that repair occurrence happens at a faster rate. That's why when people started to get Botox in their late 20s or early 30s, they say, Hamid, and when they're in their 40s or 50s now, when I treat them now, they say, Hamid, Botox doesn't work as much as it used to work. Obviously, what they don't realize is the skin is slightly getting older, and the elasticity of the skin is not that great to repair itself. So it's not Botox that making the skin looking older or repairs slower. It's a natural process of aging, really. And whether you did Botox or that person did Botox, obviously, if they didn't do it, the skin would be at a worse condition than if they started preventing it at a younger age.
That makes sense.
I hope I answered your question. Sorry, I don't know.
That makes sense very well. Thank you. That was great.
And also one more point, because we talked about cosmetic products, cosmetic injections, which is considered Botox and filler. Then we have cosmetic surgeries and plastic surgeries. So once we get to more serious cases, exactly, after the elasticity of the skin is reduced, and obviously there are conditions that plastic surgery will come in hand and, you know, cut the skin or pull the skin back. So that's another level of cosmetic world as well. So we obviously start with the least expensive, obviously, and to get better result, looking after the skin, moisturizing, putting UV protection, sunscreen, and also hand in hand with cosmetic injection. And later, I usually don't recommend Botox or filler for people that I don't see that I can help with my work or my services. If I see the skin is very saggy and the person needs a surgical intervention, I usually refer them to a good plastic surgeon or a cosmetic surgeon, which is on their own. They are separate world to tackle the issue or help the person.
That's awesome. That's great. Beautiful.
Thank you.
How about earning and working hours? How is earning and working hours in this industry?
Look, it varies. It's a very fresh industry, so people come in different roles, and obviously it's a work of art, work of hand. We have people from making 50K a year as a practitioner, as an injector, up to probably 5-6 million a year. So it's a big range. But average people, working hours are very flexible. Some people prefer to work on Sundays or Saturdays, Sundays, because most people work during the week, except this Corona situation. But the practitioner can choose to work 2 or 3 days a week, really. If they're really, really busy, they probably prefer to work 2 or 3 days, 4 days, and take the rest of the week as a break or looking after themselves. So the working hours, flexibility is very flexible.
That's good.
Obviously, you can't do night shift, because in nursing, flexibility is even further, or in medicine, you can do night shifts and work in different areas. But making money, I don't know, probably starts from $50 an hour, $30 an hour as a beginner. If you're a beginner, you're starting from $30 an hour. That's same as how much people get paid in hospitals as a graduate nurse. Around that vicinity, I don't know. I'm pretty old. It's probably more. No, I'm not old. I'm saying, like, since I work in hospitals, it's like 15, 16 years ago. So I don't know what it is now. But anyway, it can start from that. Average around $100 an hour. If you're a reasonable, injector, you make about $100 an hour, which is good. I think, given a lot of jobs that requires so much more skills, they only pay, like, if you're lucky, $50 or $60. Again, if you have a good clientele base, you have a good repertoire with your friends and your colleagues within your industry, you can do really well.
And you can grow and get to upper level.
Absolutely. There are so many opportunities, because it's a very young industry and there's so many fields. Can people focus, you can work on a pharmaceutical company as a representative or as a trainer, or, you can decide to work on casual basis 1 or 2 days a week at a clinic, or you can go on and own a clinic, get into partnership with another clinic and have your own kind of a small business.
Thank you, Hamed. Is there any tip or advice that you're going to add at the end for those who immigrated to Australia, they really, their goal is to be a cosmetic injector and get to this kind of area of the work, or those who graduated from university and they have this goal on their mind? So do you have any tip or advice for them?
Like, if someone's migrating to Australia as a professional, like as a nurse, registered nurse, or a doctor or a dentist, obviously they have to go through APRA's exams and they get registered with APRA. After that, they obviously, we talked about this a bit earlier, about taking extracurricular courses to feel comfortable, or joining a clinic to learn. But if someone's coming to study here, I think obviously it's to people's liking what they want to study, but they can study nursing. They can do not pharmacy, because I know on one of the questions people ask how a pharmacist can inject. pharmacists unfortunately can't inject in Australia as a cosmetic injector. I think the only thing pharmacists are allowed to do that is vaccination, like flu vaccine in their pharmacy. So they have that privilege. But no, I don't use my pharmacy background as something, you know, that legally I can practice. I use my nursing registration, but nursing knowledge helped me to understand molecule, how it behaves in the skin. And obviously when you're reading a scientific article, it helps to have a good you know, background knowledge of pharmacology, so you can educate people, you can explain in more simpler language how actually these molecules work.
That's true. Awesome. Thank you very much.
I hope I answered all your questions.
Yeah, definitely. It was so great, and I'm sure my audience will really enjoy. Thank you very much.
It will be my pleasure to help. Thank you very much. You can add my professional Instagram, Hamad Cosmetic Injector. You can add our clinic in Roselle, Soothing Care Clinic. But the name is going to, I think it's going to be changed soon, but more than happy to assist you in any way, always.
Thank you very much for your support. Okay, guys, hope you enjoyed watching the conversation. Please give me a thumbs up if you liked the video, and don't forget to subscribe to my channel if you want me to produce more video like this for you. Thank you.